welcome again to Sihat Beyond The Clinic podcast. Today we've got someone very prominent with us, MP Chean Chung, Ali Parliament Petaling Jaya. He has been a leader in the region as far as healthcare transformation is concerned. So today we have got Dr. Sean with us as well. And MP, thank you for joining us. Thank you for accepting our invite to participate in our podcast about health, well-being, and the community wellness around Malaysia. So over to you, Dr. Sean.
Yeah, I think the very important thing is that us as healthcare providers, and also especially because we were affiliated with UNC Malaya, which is within this area.
Yeah.
We are definitely we have a lot of concern with the healthcare situation around the area.
Yeah.
And for you, thank you very much for joining us. Because YB, you are the Member of Parliament for Petaling Jaya, and you definitely know the demography of this area. Would you mind sharing with us a bit about the demography of health in this area?
If you are talking about just my constituency, there are about 400,000. But MPPJ or Petaling Jaya City Council, altogether we have probably slightly more than 1 million population now, including the we call it transit residents, meaning they work here, they might not be voting here, right? So yeah, that's PJ, a very vibrant and dense, as well as a very close. I think the biggest satellite city, I think out of KL.
Of course. Also, one of the things that we notice is that when we are driving around here, we notice a lot of old folks' homes.
Yep.
And PJ is a aging kind of a demography, right?
Yeah. PJ is aging on one hand, especially the old side of PJ, the section, Old Town, New Town, right? New Town is not new anymore. But we do have young population, but probably at Damansara or the Kota Damansara near Sungai Buloh side. So yes, more and more old folks home are set up here due to several reasons. First is due to its location. Yeah, but secondly, also cater to the demands of this aging society.
Yeah, absolutely. YB, so as we are aware, when we speak about the public hospital across Petaling Jaya, we've of course got the Pusat Perubatan Universiti Malaya.
Yep.
And then of course on the outskirts of Petaling Jaya, we've got HKL, we've got other hospitals in the outskirts like Hospital Unpack, Hospital Shalam. All these are within drivable distance, but when we're speaking about population who are aging, who is having an increased demand for healthcare, and also the need for immediate access to healthcare, then definitely there is a need for another government facility to be in place in Petaling Jaya. So just curious, what are the key reasons behind your push for Hospital Petaling Jaya to be manifested?
Simply, as I have mentioned, due to aging trend, growing population, and also increasing density of population, there is a greater need ever to have healthcare facilities, public healthcare facilities to cater to the needs of people. In the past, probably PJ is overlooked because you can sometimes you just pass by, right? So they built hospital around Petaling Jaya. We have the old HKL, as you have mentioned, and then we have the Shah Alam, we have Sungai Buloh, we also have Seri Kembangan, the Sedang Hospital. But it's time to revisit PJ after 4 to 5 decades. We have good private providers, I do not deny that, and some are non-profit. For instance, Asunta Hospital has done a brilliant job in serving the community in the past so many years, right? So it's a well-known brand, it's a household brand nationally. But on top of that, I do see that the current setup of having just 2 clinic kesehatan to cater to the needs of PJ folks, I think is inadequate. At the same time, we are also undergoing the replanning of PJ. So replanning, rezoning, some industrial areas are no longer suitable. So I thought it's a good time also, because when we talk about hospital, land is always a must discuss matter. So it's good to seize this opportunity to pull in the needs of the people, which is really to take care of their health.
I just want you to help clarify this a bit. Is it EP09 or government
hospital? Actually it's not. It's a teaching hospital. So many would get confused, including my constituents. Some will go there expecting minimal payment, but then they were slapped with quite a hefty bill. Then they come to my office and asking for whether I could help, right? So just to clarify, take this opportunity also to inform the public that PPUM is not a public hospital. It is a teaching hospital. Even the public wing of it caters to teaching needs. And so they have a different charging method. They also have a different menu and price.
So there you go. YB has highlighted that the charges, the cost of healthcare in PPUM is not similar to the regular government hospitals that are across Malaysia. So in that context, we've also got a lot of private hospitals, that's what YB has mentioned. So do you see the role of private hospitals in assisting the current healthcare situation in Petaling Jaya, YB?
The private hospitals or private healthcare facilities are serving those that could afford, right? And definitely in PJ, there are a segment of people that would never need a public hospital. But if you look at the other side of PJ, and sometimes just neighborhood, right? I don't need to name them, like the entire PJ. We have a combination of the high-end residential areas and also the very high-dense flats, apartments, and some a very old area that requires a lot of attention. So I would argue that it's time to revisit and to look at how all these basic rights, because if other areas that are relatively maybe having same demographic, they are having hospital, why not Petaling Jaya, right? And it's not just serving Petaling Jaya, but given its strategic location, it also helps to cater to the needs of surrounding areas.
Yes, of course.
Yeah, right.
Right. So I think part of your work advocating for PJ Hospital has got quite a bit of media attention and all this. Can you tell us the work that you have put behind in regards to getting a PJ hospital built? Especially, you mean, of course, we have got the document from Kamahas.
Yeah, it started by having engagement actually with PPUM. So they told us PPUM alone could not serve PJ residents well. I think operating beyond its capacity. And at the same time, the clinic kesihatan people also came to me and said, long queue, can you just sponsor some kipas fans? So then you know how serious the queue time and also how busy and exhausted our medical personnel there in our clinic kesihatan, because it's only satellite facilities, right? So from there, floated the ideas of having a public hospital, and when we look around, it's logically, economically sensible, because really there is no single public hospital in the vicinity of PJ.
Absolutely.
And from there I started talking to the ministry, and by asking questions, having personal engagement, it's quite encouraging. They all realize, oh yeah, so PJ tak ada hospital. So I think as people's rep, to the least we highlight this. We also pinpoint this to decision makers so that they do not overlook this situation.
So I think we're standing in a standpoint where we also rakyat and we also healthcare provider. Both of us represent both that aspect.
All right.
So YB, in order to develop a hospital, a government facility, number one is definitely the infrastructure.
Yes.
So we've discussed infrastructure, the land, okay, that one we've discussed. But how about equipping the hospital with the right manpower, the workforce?
Yeah, but even before that, land was a serious issue in the past, where even the local council, the state government could not locate a suitable plot of land until these few years, where the industrial areas are undergoing redevelopment. So, and finally, I think after all the push and discussion, we managed to allocate a plot of land just very next to the One Academy, Container National. There's a free plot of land that the original owner agrees to a land swap. So the land will be free. So if not, it will cost, I think it's about how many acres? It's about 19 acres of land. So if we take up portion of it, easily it will cost more than 100 million. Already, just the land cost, right? So, and total cost is about 300 million. So just the land. And before we talk about having how many beds, right? How many doctors, operation costs and all that. But which I believe under the Rancangan Malaysia, I hope the rolling plan will include PJ as a very important showcase to the world, right? Next to Kuala Lumpur, we have the B40, but not served by an adequate healthcare facilities. So my argument is that if you, I mean, it's definitely politically and also, what do you call that? Technically right to build more hospitals at rural area, but it should not overlook the issues of urban poor, issues of the malnutrition problem in urban area, which are already highlighted by UNICEF and many other agencies.
Maybe when we talk about wanting to build hospital, then we definitely one part of it, one very important part of it is going to be the funding itself, lah.
Yeah.
Right. So, what are your thoughts on this so far?
It's sometimes hilarious if we look at what happened recently after the war. Then people realize, and even the decision maker on top realize that, wow, every month we are now the subsidy of petrol, balloon and diesel, balloon to from probably a few hundred millions a month to 4 billion a month. And it's not a year, so it's shocking. And all these figures, well, we all know roughly how much to build a hospital, definitely more than enough. Even by just saving 1 month of subsidy, we can already build quite a number of hospitals and to operate it. So to me, really, priority remains, I think, the top concern. It should become the top concern of decision makers. Whether do we want to keep burning, continue burning fossil fuel, polluting the environment, and also, I think, giving a lot more health concern to the people with PM 2.5, with a lot of air pollution, or should we allocate something for healthcare, for public transport, and also for other more sustainable means?
So thank you, YB, for sharing your insights today pertaining a very crucial topic in Petaling Jaya. So looking ahead, what is your vision of a healthcare or a equilibrium of healthcare ecosystem in Petaling Jaya?
I would like to pay, I mean, if this will be given green light, I hope soon. I asked the question in Kamahas in the Parliament on 3rd March, well received. So I hope this will be given more attention and eventually got a green light. But after that, we shouldn't just stop there, because healthcare is an ecosystem, right? I am particularly concerned about the caregiving industry, where with, I think, a lot of push are needed to professionalize, yet at the same time offering caregiving services at an affordable rate. Now there is a big gap. The way I see it, in some private hospitals, they are offering it at a very high 4-digit charges per month, right, which are not affordable to many. But on the other hand, we are seeing some unregistered old folks home, so-called. Actually, they are also giving very simple and basic, but unqualified, I think, caregiving services to the people. Some are around PJ. So to me, it's something that is intolerable. I would, and I've been running all these events, awareness, or even to to train their children how to take care of your elderly at home, right? I'm working with Masok Care and some other caregiving associations to raise awareness. But I believe eventually it's about policy.
No, definitely. So I think over here we can talk a little bit about the care economy, right? Because this is very important. As our population ages, Malaysia is approaching an aging society. Definitely, we'll be talking about more people coming out needing to take care of our elderly.
Yes.
And a lot of times this is quite costly actually. Costly not just in terms of, like you mentioned, a few thousand ringgit per month, but sometimes also about the time and effort itself.
Yes.
So like people have to go and work. After they go work, they go home. And then when they go home, they have to take care of their parents. This would actually be quite what kind of policies do you think that we can push for in regards to this so that it can support our society?
I think it's time to revamp some of our ministerial function because sometimes all these ministries exist for decades without really responding to recent needs. Like care economy is definitely something big, but now it's like under the purview of Ministry of Women and Social, Family. It's a bit here and there, and to me we should reorientate and making sure that there is a single powerful ministry handling the social safety net. And from there you can map out for the senior citizens or the gray silver hair generation, right? Then we can provide a roadmap and we can study, right? Because it's not just about taking care of them. It's about their lifestyle. It's about how can we map their morning to evening routine. How can we have an active community center to encourage active living, right? And even I think the local council should also be involved to provide traffic light that responds to senior citizen, longer maybe beeping, right, and all that. So it requires a holistic approach. We talk a lot about that, but the ministry's name is still the same after so many years. This is my only complaint. Yeah, I can't complain too much later. I won't get my hospital.
I think when we look at Singapore, there's a few towns itself.
Yes.
The planning itself has been quite supportive.
Exactly.
We need local councils involvement, not just about for the traffic lights.
Not just
that. Also about like making it safe so that we can walk on the road.
Yeah.
The lanes itself.
You're right.
How do we slow down cars so that they don't actually do that? Some places have got zigzag kind of patterns.
You're right. I'm talking to some NGO, interestingly, just to share, to download app, to trace also their active living level. So if they work hard, I'm talking to some maybe shops, right, to have a small gift. So it's like gamify healthy living for senior citizens. And also at the same time, encourage them to use gadgets. Because it's something that's important, sometimes for maybe life-saving, sometimes emergency. So this is what some NGOs in PJ, which I'm very grateful, they are giving all this option. Unfortunately, still it can only be a pilot because it requires the minister and the ministry to listen and then to push for it. Singapore has very good apps. Again, I mean, Singapore is a city-state, so relatively easier. But we can't just attribute this, we shouldn't just blame this because, I mean, Singapore is small, but they are active. They are doing a lot of good things. So the good one we should learn.
So I think to conclude the session already, so what we understand is it requires a strong political desire, a strong push, as well as support from various parties involved. So from policymakers to politicians to also public-private partnerships in order for this to manifest, to make Petaling Jaya a well-balanced ecosystem as far as wellness and health is concerned. Any key take-home messages towards our listeners out there, right?
I hope the ministers will rethink and keep listening to the grievances of the people and respond to it. We have been giving quite a lot of suggestions, but usually rarely we get a very positive support, concrete support lah, not just saya sokong, right? Go and do what you like. Like all these good things, if you require a sandbox or pilot project, let's just do it, right? The minister can say just launch it and try it out. I'm still waiting. So after giving so much suggestion, so hopefully one day they will listen.
Okay, so thank you to our listeners out there. Thank you for staying tuned to our podcast, Sihat Beyond The Clinic. Stay tuned for more. See you in the next episode. Bye-bye.
Thank you. Bye-bye.